But as the SHBG goes up, it makes your total testosterone look just fine. Thank you very much. But it actually reduces the free testosterone.
Got
So
it.
now if your doc is not paying attention, if he's only measuring a total, not a total and a free, he's going to miss the fact that you are missing the active form of testosterone, which is the free form that goes into cells, that goes into the nucleus, that connects with the androgen receptor and drives the DNA. And he'll just say, oh, your total testosterone is fine. And it's not.
Welcome to the Capital Integrative Health Podcast. I'm your host, Dr. Andrew Wong. Today, we are happy to have Dr. Alan McDaniel join us. He is a good friend, esteemed functional medicine expert in the field of endocrinology, allergy, and chronic fatigue. In this episode, we shine a light on a topic that affects many men worldwide, low testosterone. Dr. McDaniel brings a wealth of knowledge and experience to our discussion, having dedicated his career to unraveling the complexities of hormonal imbalances and empowering men to regain their vitality and well-being. What exactly are the underlying factors that contribute to low T? How do lifestyle choices, environmental factors, and even emotional well-being impact hormone balance? These are some of the questions we'll explore with Dr. McDaniel today as he takes us on a journey through the multifaceted nature of low testosterone, uncovering the root causes that often go unnoticed in conventional medical approaches. Join us as we uncover the root causes, gain practical tools for rebalancing hormones, and embark on a transformative journey towards reclaiming your vitality and optimal health. Welcome, Alan, to the podcast. Thanks so much for coming on today.
Well, Andy, thank you so much for inviting me. It's a pleasure.
Yeah, so to start, we know that you're an expert in functional endocrinology, and let's kind of just talk to our listeners. Endocrinology is certainly a pinball machine, I would say, that we don't always know where the ball's going to end up even. But let's talk about tell our listeners a bit about what drew you, Alan, to become a physician, and then especially an integrative functional doctor, and then what do you enjoy most about what you do?
Well, thanks, Andy. I think it's really dharmic. I really never seriously thought about much of anything else. I think I was put into the right family. My mother's family, every other generation, as a physician, going back a long time. My father and his father were engineers, so they gave me that nice little obsessive compulsive ability to look at details and then put it together in the big picture that I needed. And I really never had a serious plan to do anything besides medicine. I got into functional medicine because my surgical training taught me that a surgeon should always know 2 or 3 approaches to the same problem. If the anatomy is different, if something's stuck down, you got to go the other way. And that has been enormously useful in working with my patients in the clinic. In the about 1987, I was looking at allergy because I'm an ear surgeon, and allergy causes most chronic ear disease, in my opinion. And I then had several patients who made me look at the yeast connection, which was my serious intro into, integrative complementary medicine. It turns out that that was actually a fantastic diet for insulin resistance, which affects 40% of Americans, which is why once I started doing it, I was hooked. It was the most amazing treatment. And so I haven't looked back since. I've just gotten more and more integrative. It's so much so that it's hard to tell if I'm on the cutting edge or on the lunatic fringe sometimes, which I think means we're doing it right.
Yeah, absolutely. Yeah, I think there's always, progress that happens at the margins and at the margins of innovation. So you're an integrative, intergenerational physician who it sounds like started out as a surgeon, and now you're really working with patients and working with, I think, the public too in terms of education to ideally avoid and prevent surgery. It sounds like that's kind of what happens when you kind of address the root causes, is that a lot of times people don't need surgery.
Right. I started doing allergy work because I was convinced that I couldn't reconstruct an ear and make it better than the ear God put there in the first place.
Yeah.
And since the original ear went bad, I had to get rid of the cause of the problem. So I did really aggressive allergy work, and I got great results. Nice compliments from my anesthesia staff, for instance. And then that got a lot of my patients over problems I didn't even ask about, like chronic fatigue. So then chronic fatigue patients started coming to see me. And that was my intro to endocrinology and nutrition, where I am stuck today. So I'm not by any means trained to be an endocrinologist. I'm off the tailgate. I'm just self-taught. Uh, I'm not a researcher, but I am a bit of a scholar. I've read a lot. And with my patients' permissions, we try a thing. And when it works out, I try it again. So here I am.
You're a scholar. You've published a lot of articles. In fact, the reason why that we got together is because I started reading this article that you've written in the Townsend letter a couple years ago on low T, and I was so blown away by it. I was like, no one ever explained it that way, especially in that unique Alan style that you have. And I was like, we need to get you to talk. I know you've talked with us a lot here at CIH and talked with you personally. So yeah, really wanted to appreciate and express gratitude for your mentorship and friendship.
Thanks, Andy. It's really a privilege. You helped me fulfill my dharma. I have a little dharmic statement on my computer. I learn, I teach, I help practitioners help patients. And at this stage of my life, that's my main focus. And I'm
Yes.
really grateful that you guys honor that and can hear what I'm saying. I'm a slow learner. I'm slow on the uptake. And so I have to really understand something to be able to get it. And I think that helps me explain it.
Awesome. Well, thank you so much, Alan. Well, let's go slowly also and deeply into this rabbit hole topic of low testosterone in men. Now, we talk about testosterone a lot. It's very, I think, popular in the mainstream media, let's say. But let's talk about from a scientific perspective, why is testosterone so important? What does testosterone do in the body? How does it function in the body?
Well, testosterone is incredibly important. In utero, it develops the fetus into an anatomical male. And in utero, it also directs the development of the brain to be more disposed to things like rough and tumble play. It is anabolic, so it builds up a body in both male and female children because both of us have testosterone. Uh, it helps to develop our bone density, our muscle mass, our cardiovascular system. In adolescence, testosterone is the precursor for women's estrogen. And in men, we have a different amount of testosterone, and more importantly, maybe a different ratio of estrogen to testosterone. And so, in the yin and yang of endocrine development, we get more yang. We get more bone density, more muscle mass, more aggressive, smack them down attitude, more libido, and bone marrow stimulation. Testosterone connects to the androgen receptor in the nucleus of our cells, and it is a DNA transcription factor that drives the running of programs that give us a robust masculine body. And through non-genomic receptors, like in the brain, the sigma-1 receptor, testosterone gives men a more aggressive, more optimistic attitude. Like I say, rough and tumble. You watch boys and girls playing, there's a little difference in the brain. And then in completely not related to receptors, testosterone in the tissues is converted to estrogen. So in the bones, in the lining of our blood vessels, the endothelium, in our joints, our cartilage, testosterone is converted to have really high levels of estrogen in those tissues, which further the function and maintain those tissues in a healthy fashion. So testosterone is one of the big things that helps to create and develop and maintain healthy, sexually dimorphic bodies. It means men and women look different and act different.
Got it. Got it. Thank you for translating that to English there. I appreciate that. Appreciate that. And so it sounds like, just to follow up on that though, Alan, that testosterone rather is important in both men and women, and all humans, it sounds like.
Absolutely. Yep. There are a few unfortunate souls who were born without androgen receptors or without estrogen receptors. And, you know, they don't do that well. And I think people with absolutely none probably don't do at all. So it's you know, hormones are important. I learned that years
Yeah.
ago.
Well, let's go into kind of defining what is low. And I think obviously we know in functional medicine there's what is considered the standard range or the conventional range of what is low, and then there's also probably what's considered, you know, suboptimal, or, you know, considered conventionally low normal, but then it's sort of suboptimal. So how does Dr. McDaniel here define low testosterone?
Well, right. It's like art. You know, I don't know how to define it, but I know it when I see it. Well, the first place is that there are the first thing I try to do is look in the literature and act like an academic and act like I know something. And every different study for the last 20 or 30 or 40 years has used different definition. I personally like the European male aging study. They define low testosterone in the context of a man who has about 3 symptoms. So, and that makes sense. If a fella is coming to us, we don't go out on the street and hand out orders for blood tests for every man that walks by us. We wait until they come to us with complaints. And so, you know, symptoms obviously is a key piece of it. And the EMA study looks at symptoms, but they draw cutoffs of blood. They call a low total testosterone less than 320 nanograms per deciliter. And that's right in line with the old Framingham study that's been going on forever up in Boston. They showed that 324 is right at the lowest 2.5 centile of their bell curve, which is 2 standard deviations below normal. And then the Europeans define a low free testosterone, which I think is the most important measure considerably, as less than 64 picograms per milliliter as determined by the liquid chromatography tandem mass spec method, which is the new one. And a lot of us use the immunoassay, which if you do the units conversion, the EMA cutoff is 8.7 picograms per mil in the immunoassay. So a lot of our older patients, you know, they come in, they're normal at 6.5, and the range of normal is 6.4 to 18. Those guys are probably low. You know, the big advantage, by the way, of doing free testosterone is it is broken down by age brackets. If you're looking only at total testosterone, then you're comparing, you know, my 30-year-old son to his 70-year-old father. You know, it's all lumped together in the same pot. Whereas the free testosterone is not only the biologically active testosterone, so it's clinically the most relevant, but for our convenience, it's also broken down into decade groups. So a man in his 20s to 30s is going to have this value as normal. A man in his 70s to 80s is going to have way down there normal.
Does the testosterone level, Alan, affect things like athletic performance, sexual performance, drive, vitality, all of that?
Absolutely. When you drop down when your total testosterone drops below 430 nanograms per deciliter, people will have pretty reliably reduced libido. So there's some nice studies out showing cutoffs of symptoms at different levels of testosterone. Like if you get down below a total testosterone of 200, oh man, you're going to start to get depression, uh, apathy to life, loss of optimism, less energy. They don't work as well. They can't sleep as well. That memory and concentration. I mean, who knew testosterone gave guys good cognition? I've raised 3 teenage sons. Okay, testosterone made them act like squirrels.
Yes, yes.
but actually, it preserves the brain and keeps us intact, and it protects us from things like Parkinson's and dementia.
Okay.
So testosterone's good stuff.
So a lot of sub questions that are swirling around my head right now. So let's talk about the chicken or the egg question. We know that 88% of people or more in the U.S. have metabolic syndrome. Insulin resistance. It maybe I think you said maybe a little bit less, but it depends on the study, I guess, too.
I think there's pretty good data from NHANES that 40% of us are insulin resistant by heredity.
By heredity, okay.
And the problem is that the standard American diet has taken even people who don't have a strong genetic predisposition to insulin resistance and made us insulin resistant by inactivity and lack of sleep and chronic stress and really bad diet changes.
And toxins in the diet too. Yeah.
Right. And in the environment,
in the environment.
and endocrine disrupting chemicals.
So someone has metabolic syndrome and has weight loss resistance, can't lose weight or is gaining weight, and we test their labs and they have low testosterone.
Mm-hmm.
That's a chicken or the egg question that I had for you, which is the low T contributing to the metabolic inflexibility that causes the blood sugar and insulin issues, or is it because that because someone has excess belly fat and the adipocytes are converting the testosterone to estrogen, stealing that away?
Yeah. I'm looking at the lifespan of a human from conception to death. The first thing that comes is the genetic predisposition to insulin resistance. Most 18-year-olds have prodigious testosterone, although I'm seeing a few that, few teenagers, not so much. I've seen a 13-year-old type 2 diabetic in my practice. It's dreadful.
Yeah.
So, but people usually start with pretty good testosterone, and then as their diet and stress depresses the production of testosterone. It's part of a normal protective response. When we're really stressed, we don't want to waste the raw materials to keep us alive by making hormones that help us reproduce, which you don't want to do anyway when things are really bad.
Got it.
So then the production of testosterone drops, the raw materials for the use of testosterone are diverted to cortisol and aldosterone to keep us alive. And the stress leads to insulin resistance, which truly snowballs. It makes an avalanche. So it causes excessive production of insulin, which is an energy storage hormone. So we get fat, and as we store energy, we increase our visceral fat, which increases the enzyme aromatase, which converts the testosterone we are still making to estrogen. So that you are right that 40% of men with metabolic syndrome and 50% of men with type 2 diabetes have low testosterone and elevated estradiol because they're losing their T to estrogen, which really works against us, and is why a lot of fat men need a bro, because they're making so much estrogen, they get breast enlargement, prostate enlargement, and it's a mess. It's a cluster fornication. But I think the genetics for insulin resistance and a bad diet and lifestyle probably are the initiating. They're the triggering, and the testosterone is just the victim.
It's the tail. Yeah.
I think so.
Oh, got it. Okay. Thank you so much for that clarification. And going back to
That's
the,
just my opinion. Don't take it to the bank,
it's an
but see
expert opinion. We'll
if it
take it.
fits.
We'll
Uh,
take it. We'll take it at least
you have to
to the
smile
local
and
bank.
you have to
Yeah.
smile and wink when you call me an expert because my credentials are just I do it. Okay.
Yeah. 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 Experience is the best teacher, though. So yeah.
If you keep your eyes open, there are a lot of mainline endocrinologists who should have a lot of experience, and they say things I think are incredibly naive. So,
Hmm.
you know,
Hmm.
that's what makes incarnation so interesting, and I think maybe why we have to come back.
Nice. Nice. I like that. I like that. Alan, let's talk about one of the questions that I think is generated from the EMA study comment that you made, which is that what are the common symptoms of low T? What are
Okay.
those symptoms that people typically look at?
Well, I think I mentioned the mental symptoms, starting at when total T drops below 430, libido goes down.
Libido. Okay.
Okay. When testosterone drops below 200, then you have the affect, the depression, the enjoyment of life, optimism. You have lower energy, less productivity at work. People get sleep problems, and then cognition, memory, and concentration and planning starts to get flaky. Um, Genitourinary symptoms include fewer and weaker erections, as a guy I know calls leaners, not boners. There's reduced semen volume with lower sperm count. People get prostate symptoms for a variety of causes. Okay, it's not just low T by any means. Breast enlargement I mentioned earlier is aromatase converts testosterone to estradiol. And then the physical problems are because of the lack of the trophic function, so that muscle mass and strength and athleticism are all reduced. The broken bones from loss of bone density, uh, arthritis, loss of support of the cartilage. Uh, Men get hot flashes, vasomotor flashes,
Hmm.
when they have primary testicular dysfunction.
Hmm.
Hot flashes are caused by the pituitary hormones that drive the gonads to produce sex hormones. The British actually produced this in a study done way back in the 50s when they infused women with LH and with FSH and gave them hot flashes. Uh, and then low hemoglobin is another consequence of the loss of the trophism. The bone marrow just doesn't make as many red blood cells. Uh, and then there are other actions, but I would recommend your viewers to the ADAM questionnaire, the androgen deficiency in the aging male. You can Google it. I've got a website here for it, but nothing's more boring than reading long websites off of it. So just Google low T questionnaires or ADAM questionnaire, and there are a few references that are academic from the early part of this century, and then I think 2017, 2018 practices start putting it on the line, so you can pull off your own copy, and it's
Great.
pretty handy.
Thank you. Thank you, Alan. Definitely check out that ADAM
No worries.
questionnaire. We're always looking to get to the root cause here. So let's discuss the causes of low testosterone. You mentioned high cortisol, stress, poor diet. What are the kind of common, just to summarize for listeners, root causes of low T in
Okay.
men?
I've got a little list. Thank you for sending me your questions ahead of time.
Yeah, of course.
Stress is huge. I mean, stress, a normal part of the stress response is the blocking of the production of sex hormones. The luteinizing hormone is just blocked. And so not only do the testicles not convert cholesterol to pregnenolone to progesterone to DHEA to androstenedione, but LH also takes the precursors over from progesterone to the DHEA and androstenedione. So the loss of LH is really big. And stressors include the lack of sleep. Some of my patients act like I'm crazy if I think they should get more than 5.5 or 6 hours of sleep.
Even sleep apnea, yes?
Oh, that's on my list. Yeah,
Ah, got it.
absolutely. Sleep apnea is a horrible bandit of our quality of life because we don't even know what's happening. We
Yeah.
wake up feeling like crap and have no idea that we've been awakened every time we get into stage 3 sleep. It's like going into a restaurant. Sleep apnea, you should have 5 stages of sleep, 1, 2, 3, 4, and then REM sleep, and you have 4 cycles of that a night, and you're good to go, maybe 5. And sleep apnea, as soon as we get into stage 3, it will wake us up. So we go stage 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3 all night. We never get into REM sleep. And it's like going into a restaurant and ordering a meal, and they bring you water and maybe some rolls, and then you get up and leave. And you go to another restaurant, you order a meal, they bring you maybe water, and you get up and you leave. And you've been in a restaurant all night, and you've never gotten a meal. And that's what
So
it's
you're
like.
saying you were going to Olive Garden all the time. Sorry for all those Olive Garden fans out there. Yeah.
Well, their service is better than that.
Yes. Yes,
But
absolutely. Great service there.
so and then the adrenal glands also, when we're stressed, the adrenal glands need the same precursors that we use to make testosterone and sex hormones. They need the same raw materials to make cortisol and aldosterone to keep us alive. So the body, the stressed body, like any sensible householder, when money is short, you put it into the things you absolutely need to stay alive: food on the table, heat, the electric bill, the water bill. And so testosterone and estrogens, forget about it. Our body is just programmed not to do that. And then, of course, we also mentioned the standard American diet with our fast carbs and all of the huge amount of insulin that we produce because of that causes us to be obese. And people who are obese have a 10 times higher risk of low testosterone than people who are not obese. It goes from 0.4% to 5% with obesity. And 50% of diabetics have low T. 40% of people with metabolic syndrome you were mentioning have low T. Genetics make a big difference. About 40% of us, as we mentioned, are insulin resistance, which exaggerates the problem caused by our crappy diet. And then aging. Aging doesn't inevitably cause problems, but it is strongly linked with low T for a variety of reasons. Most commonly is because our hypothalamus changes. Women have menopause because of hypothalamic changes, and then we all act surprised that men have womenopause for the same reason. No, it's not right. How about late onset hypogonadism? Because
Okay.
the rate of oscillations, the vibrations, they call it pulsatile function, changes. It becomes more sensitive to inhibition by even a small amount of testosterone. And so hypothalamic hypogonadism is the main cause of men with late onset hypogonadism. Second cause is that the testicles are changing. We are losing Leydig cells. 70-year-old men have testicles that are approximately 70% the size of 18-year-old men, just from a loss of some of the Leydig cells that are the key players. And then with age, our liver makes more sex hormone binding globulin, which takes the amount of testosterone that we can make and hoovers it up, which is great because the liver doesn't break it down and the kidneys don't pee it out, but less of it is available. So 99% of the testosterone that's bound to SHBG is out of the picture. Your body can't use it. And
Alan, excuse me, why does the liver as we age make more SHBG, sex hormone binding globulin?
I don't know.
I was hoping you would know that. No one knows the answer to that, but
Well,
someone
neither do
does,
I.
but
I
maybe
tell you what,
maybe not
alcohol
humans. So
causes you to make more SHBG.
okay. So bourbon would
What
not
that's
be a
worth.
good idea here. Yeah.
Maybe that's why I don't like it. No, it's not a great idea. But as the SHBG goes up, it makes your total testosterone look just fine. Thank you very much. But it actually reduces the free testosterone.
Got
So
it.
now if your doc is not paying attention, if he's only measuring a total, not a total and a free, he's going to miss the fact that you are missing the active form of testosterone, which is the free form that goes into cells, that goes into the nucleus, that connects with the androgen receptor and drives the DNA. And he'll just say, oh, your total testosterone is fine. And it's not. Okay. Um, and so there are opiates. We have an opiate problem in this country.
Yeah.
And opiates, how many people with chronic pain in this country? Prodigious numbers. Opiates disrupt the receptors that drive the production of sex hormones. So something like 30 to 40% of men taking methadone have low testosterone. And there are other endocrine disrupting chemicals we talked about. I mean, there's a reason the alligators in the Everglades have been having decreasing penis size for decades. It's pretty bizarre. I was a zoology major in college. And then there are a few causes that we need to think about and look for. Our patients shouldn't worry about, but prostate cancer will make fragments of testosterone that will go to the brain and block the production of the gonadotropin releasing hormone. And the fragments are too small for us to detect on a blood test for testosterone. So it's an invisible problem that keeps you from making testosterone caused by a prostate cancer that may not be detected with a PSA. So,
okay.
And also pituitary tumors can squish the gonadotropic cells. And so you just make too little LH and FSH because you got a pituitary tumor in there. So
okay.
Those are unusual, but I think that we docs should keep it in mind when we're working up a guy.
Yeah. So check prolactin level too in that
Yeah,
situation.
that's the most
probably.
common. Well,
Yeah.
Ask them if they've had any headaches or vision changes. And honest to God, what new patient hasn't had headache?
Mm-hmm.
2/3 of them do. But it is something to consider. And I will definitely look at LH and FSH.
Right.
Definitely, I think. So if you've got a pituitary tumor that's squishing them, your LH and FSH are going to be inappropriately low for a guy with low T. So
right, because otherwise, if someone had low T and it was coming from, say, the testicles, the LH should be high.
Right. Yeah, the
situation.
pituitary and the brain should be flogging the gonads.
The
Come
negative
on down there.
feedback,
Come on.
Right.
But the problem is, of course, the hypothalamic hypogonadism. You'll see a total testosterone of 280 and LH and FSH of 2.0, 2.2.
Yeah, that's not
inappropriately low, right? So
yeah,
that's why that's why we get the big bucks, because we have to think about these things.
Yeah. Well, at least until AI comes out, right? And then
right.
we'll have to drink bourbon at that point.
Yeah, garbage in, garbage out. Look who programs AI. It's all going to be the American Thyroid Association, the Endocrine Society. Now they're coming around. Okay, I mean, finally in 2020, they published a paper saying, hey, you guys, maybe you should think about using some T3. I've been using it since 1991, right? So they come around, but it takes a generation.
Well, that kind of goes along with the clinical research that shows that 18.5 years between the time of scientific discovery and clinical bedside treatment,
That's more optimistic than I'd heard. I read 30 years. And, Jeffrey Bland paraphrases Max Planck when they asked him, how is scientific progress made, Herr Professor? And he said, one funeral at a time. So as the old guys die out, we get progress. And I'm an old guy now, so I'm hoping you guys will pick up the torch, Andy, and get going and show me some stuff.
We'll follow your lead for sure. Thanks, Alan. Well, I guess I wanted to ask you also about the relationship between toxins, Alan, and hormones. What is the relationship there? Especially, I was wondering, are there certain toxins, say plastics or phthalates or things like that are root cause of low T, in men, and maybe even in women, if we could get to that. I guess I wanted to also ask you, if you don't mind, are some of these causes that you are mentioning as low T causes in men also low T causes in women as well?
Let me see if I can keep those questions in order. The first thing I'll say is endocrine disrupting chemicals are abundant And I don't know as much about them as you might think I would, because I'm the past president of the American Academy of Environmental Medicine. So I should be just all over that. But it happens that that's not my bailiwick. And I have found that I treat the problem as I see it. And that particular source is so hard to test, and if found so hard to get rid of, I don't spend my patients' money doing that. Unfortunately, my heredity is Scots and German, and except for maybe the Chinese, we are the cheapest people on the earth.
That's so funny. That's so funny.
And so, we know the estrogen receptor it's been called promiscuous. It'll hook up with damn near anything. As long as you have two OH groups about that far apart, the estrogen receptor loves it.
It'll just do that. Okay.
And you get into a problem. It's very much like that we see in giving women phytoestrogens, or in giving women synthetic patented versions of progesterone called progestins, like Provera. Uh, the stuff attaches to the receptor, but it does so in an unpredictable way, sometimes loosely, and it gives you just a little stimulation, so that they'll call a phytoestrogen an adaptogen, that it helps a person who doesn't have any, but it will compete with proper estrogen. And so it's actually an anti-estrogen in that response. And the progestins will just glue themselves, like Provera, methylprogestin, will glue itself to the progesterone receptor and strongly stimulate it, and you can't get it off. Oh, get off, get off, get off. And so that I know that must be happening with androgens. And with androgens, we mentioned the yin and yang balance between androgen yang and estrogen yin, pretty clear from reading the Chinese traditional medicine descriptions. And it's what it is we're in a damn soup. We're in a mess. Our society is saturated with chemicals, and the best that I know how to do it is to measure it and then do what we're talking about, or what we will talk about, to try to restore a proper balance. And I would I do try to get my people to have a decent diet and lifestyle and take the proper supplements. And if someone has the ministry to get onto an organic diet, that's fantastic, but don't breathe when the bus drives by. It's, we have a real problem in this country. We have gazillions of chemicals, and none of them have really been safety tested,
Right.
except by giving, a shovelful to a mouse, and the mouse peed on it, so it must be safe,
Yeah.
So
it's sad. Yeah, no, there's so many unregulated chemicals, and a lot of them are ubiquitous in the environment now. So I think when they do those, fat tissue biopsies or something, like basically everyone is toxic,
100% of us had styrofoam in the fat. 100%.
That's crazy. That's so crazy. So how can men, Alan, we can talk about now restoration of levels.
We were talking about women's you mentioned
yes,
women's testosterone.
Yes,
let me just say that.
Sure we do that.
Testosterone is made from DHEA, and for a healthy young woman, half the DHEA comes from her adrenal gland. Thank you, adrenals, and half from the ovaries. And a lot of women have their ovaries removed still. And so those women in menopause, now in menopause, a woman's testosterone level doesn't change much. It drops a little bit, 5%, 10%. And their estrogen drops down way low. In fact, a menopausal woman has less testosterone, has less estrogen than a man her same age.
Why did the testosterone stay the same, or about the same?
Because it mostly comes from, it stays the same because a healthy young woman makes her estradiol from testosterone. And at menopause, the ovaries run out of eggs, So they stop making inhibin B, and they become resistant to FSH, and the brain is resistant. And actually, the brain is so sensitive to estrogen now that even a little bit of estrogen will inhibit it. That's a very interesting theory that I think is totally true on menopause. And so a woman basically is set up to make the same amount of testosterone she always made, but she now can no longer convert it to estradiol. The aromatase has gone away.
Okay.
And so women, if however they've had, and that's why, you can find pictures of menopausal women on the internet with a nice mustache. I've got one in my slide set because the testosterone stays the same, the estrogen goes away, and their ratio starts to look like a man now.
Mhm.
And so you give them a little estrogen, everything is back in balance. Now, some of my women do need more testosterone, usually because they've had their ovaries removed, so they've lost half of their supply. So you can make it up with about 5 milligrams a day of DHEA or maybe 10. I don't have any women taking testosterone. I've never given one of my women testosterone because I haven't needed to. Just a little bit of the right precursor at the right time of day, bingo, they should be fine.
Perfect. Thank you so much. And now switching back to the men, men with low
Yeah.
T, how do we improve, men's testosterone levels naturally?
Well, the best way I've got is actually pretty simple: diet and lifestyle, um, and then nutrition. Okay, and if that fails, you throw in some prescriptions, but that's not naturally exactly. So naturally, I want my men to get 8 hours of sleep a night, and if they snore and they stop breathing, got to get treated for sleep apnea because sleep apnea is incredibly stressful. Um, and I want my men to exercise for 30 minutes daily. And if they just don't have time, oh my God, doc, that's too difficult. Do burst exercise 3 minutes a week. There's a brilliant BBC film, lasts 51 minutes, and it's done by a Dr. Mosley, who was interested in his cardiovascular health. And so he made a little journey around Britain talking to experts. It's a free video, a free view on Vimeo. Just Google BBC First Exercise Mosley Vimeo, and you don't even need to, because the Vimeo pops up. And it's a little bit of exercise vastly improves insulin sensitivity, which really reduces belly fat, body fat, and improves testosterone levels. Also, let's face it, personal work. I mean, I think everybody, my therapist says that everyone who incarnates in this world is a hero. And some heroes get PTSD and they're not treated. So I think all of us need to do some personal work and develop a spiritual walk. I mean, church is awesome, helps me. Meditation is awesome. I don't do it as much as I should. Get the meditation timer app, but chilling down, the stress response in your brain is huge. Get the GABA levels down, up. Get the glutamate levels down. Just be thou chilled. And then a diet, of course. Uh, you know, we a good diet is described in 3 scientific ways. One is low glycemic index. Eat food that doesn't push up your blood sugar very fast or very far. Number 2 is eat slowly accessible glucose. So when we eat a carbohydrate, which we should, I think everybody needs some carbohydrates, but it should be a carbohydrate that is something other than pure glucose. There are about 24 different sugars. Glucose is just the one that tastes the sweetest, practically. And so eat, instead of white, golden brown, flaky stuff like grits and white potatoes and popovers, we should eat broccoli and carrots and red peppers. Eat red, green, purple, yellow, orange vegetable squashes. Those have complex carbohydrates that are digested slowly, that are not pure glucose, and they enter into our bloodstream slowly. And the last thing is related to this, which is the diet should be low insulinemic index. So the Aussies came up with this concept in 1994, and we want to eat food that doesn't require our body to make a whole bunch of insulin to deal with the sugar load that we got. So the low glycemic index implies it, the slowly accessible glucose implies it, but to really do it, you have to lay off the non-nutritive sweeteners like, Splenda, NutraSweet, stevia, all of these things provoke the release of insulin by a reflex, and it makes us fat. So anyway, but good diets for us are Schwartzbein and Reven's insulin resistance diet, the Mediterranean diet, the Japanese traditional diet, Mediterranean paleo ketogenic, and the Candida, which is how I got into it. The Candida diet is a great diet for people with insulin resistance, and it made people well that I had no explanation for in 1988. So all of those things are useful. And then I throw some supplements in on them too, for what that's worth.
Thank you. I just wanted to just reemphasize to our listeners that the glucose or the glycemic index versus the insulinemic index, that they are different. Sometimes people can have a low GI food, but it might actually a low glycemic index food, but it might actually raise the insulin, it sounds like.
Absolutely. I mean, Splenda is a zero glycemic index food, but it's got a massive insulinic index. I have a patient who took Splenda and her 30-minute insulin was 147. It's just
That's
massive.
crazy. Sorry, and stevia too. Sorry for all you stevia lovers out there. That's another one that tastes good and has zero carbs, zero sugar, but it sounds like it's going to raise that insulin up.
Well, it's because of a reflex. Our body is beautifully made. When we put something sweet in our mouth and we start to eat it, our paleo body anticipates we're eating sugar. And so it would like to have a little insulin ready when the sugar arrives in the bloodstream. It's like a French author said, it's like riding a bicycle. When you come to a turn, you start leaning before you get into the turn, so you don't fall off the bike in the turn. And the body does the same thing by producing insulin. As soon as your tongue tastes something sweet, it goes from the gustducin receptor through the lingual nerve to the chorda tympani down the vagus nerve, and it pops out glucose. It's the same way the gliptin stimulators work for diabetics. It's the same receptor.
I see your ENT background coming out there with the anatomy there.
Well, you operate on chorda tympanis a lot when you're in the ear, so you try not to bag them.
It's good. That's a good thing. Let's get into supplements a bit. What supplements do you recommend once people are doing the nutrition, the stress management, lifestyle? What supplements are you thinking there for low T?
Well, I mean, there's just a few general supplements that I think in Louisville, Kentucky, all my patients probably need. A multivitamin twice a day, not once a day, twice a day, because you pee it out so quickly. So you take it twice a day, your body gets 2 shots at the brass ring. Vitamin C, 500 milligrams with each meal. Vitamin D3, anywhere from 6,000 to 10,000 a day, depending on your body size. And I like a little calcium, magnesium, zinc mixture from Solar Ray. It's just a good natural thing. And I'll do other tests to see what they might need. But those are kind of my basic right after the handshake. Also, right after the handshake, I give all of my patients, and this was set out on my desk when I still had new patients coming in.
Cytozyme. Oh, yes.
Cytozyme,
I know you're a big fan. Nice.
Desiccated adrenal bovine cortex. And the key is neonatal, because the babies are born with all the nutrition in the adrenal cortex that their mother can give them. If you take an old bull like me, my adrenals bagged out, and you take the adrenal from cows that have lived out their useful time and have been put on a railroad car and taken to a feedlot and then turned into leather and sinew, there's no nutrition left in it. So that gives our body the nutritional cofactors that our enzymes need to convert cholesterol to the sex hormones. And that happens in the adrenal gland, which is why the adrenal cortex, but it happens in the gonads big time. It happens in the brain. Our brain makes neurosteroids that mellow out our mood. Neurosteroids stimulate the same receptor that Valium does, and Prozac. And also our mitochondria. Our mitochondria make their own steroids. They have their own side chain cleavage enzymes. So if you provide those nutrients to our mitochondria, then they can give us better energy if they've been lacking it. And the American diet is sadly lacking in nutrients. We eat the muscle. If we were intelligent, we'd eat the whole animal, like
Yeah,
our
the organs,
ancestors
whole
did.
nose to
Yeah.
tail. No, that's really great. And I've definitely tried, definitely some of our people here have tried that per your recommendation. So I want to thank you for that. The cytozyme seems to be a
It's
game changer for people. Yeah.
I ask my patients, what's the best thing you're doing? And a lot of them say the cytozyme AD.
Cytozyme. I want to ask you about integrative modalities. So acupuncture, body work, would that be helpful for low T?
I would put that under, it couldn't hurt if the patient couldn't afford it.
Yeah, yeah.
If there's I got my people around here are not rich. I'm a middle class guy, and I see middle class patients who don't have a huge budget.
You're in
So
Kentucky, yeah?
yeah, yeah. And so, but I grew up in DC, middle class neighborhood. So, um, I try to gauge what I ask people to do based on what they can do and
Yeah.
prioritize. DHEA is my next supplement. That's a
Okay.
partly made precursor. And the beautiful thing about it is you drop it in behind the roadblocks that are erected by stress. Stress blocks the production of LH, and LH converts 17-hydroxypregnenolone to DHEA. And so you give DHEA, you just bypass that person's stress response, and now you can fill their testosterone pathways distal to the obstruction of stress. So DHEA has been really good to me. I'll use berberine over the counter to improve insulin sensitivity, reduce obesity, reduce insulin levels. Chrysin, blue passion flower, 700 to 900 milligrams a day, is a great aromatase inhibitor, a natural aromatase inhibitor. There are other ones out. I've got a friend who's a naturopath, and he always tells me something that I can never remember. And it will keep you from losing your testosterone to estrogen.
Okay.
And one of my
Okay.
patients absolutely loves it and refuses to use anything else, even though it's a fraction of the cost. Okay. I3C, indole 3-carbinol, is a product in the cruciferous vegetables, broccoli, cauliflower, that all the kids hate. And what it does is it directs it it puts toxic waste into environmentally friendly containers. Testosterone is converted to estradiol, is converted to estrone, is converted to either 2-hydroxyestrone or 16-alpha hydroxyestrone, which is a bad actor and has a lot of strong estrogen stimulating effects. And so the I3C keeps you from making the 16-alpha hydroxyestrone. And so it neutralizes the effects of the waste estrogen that comes from the testosterone you're giving your fellas. And I think personally, I believe it's going to protect your prostate from enlargement.
Got it. Got it.
And then saw palmetto. I'm sorry, go ahead, Andy.
Oh, sorry, Alan. Back to the DHEA for men. What is your dosing there normally for that?
25 milligrams at bedtime. If you have a guy in his 70s and 80s, I've had to drop it down to 5, because what happens is they start making so much testosterone to get crunchy. It's, oh my God, they get so irritable. And, their wife will bring him in by the ear saying, do something with him. And so you need to give him just a little bit.
Okay.
There's a few studies that show 50 milligrams of DHEA can give some guys an edge. Don't honestly, really don't give guys more than that. I've tried and tried and tried. And all you get is problems. Too much DHEA goes to the androgen receptor, and it is a weak agonist that blocks the androgen receptor so that your testosterone and dihydrotestosterone can't get to it. So it works against you. And then the DHEA also goes to your skin. And remember that local conversion of testosterone to other stuff? Well, in your skin, the hair glands, the sweat glands, the skin is very active in making steroids, oddly enough. I guess it's because we make vitamin D out of cholesterol. but the DHEA is turned into DHT in the skin. And so you get, outlaw hair growth and a lot of acne, especially all over the back. And it's damned uncomfortable. So, hold the DHEA to 50. And I think really very few of my guys take any more than 25 at bedtime. I like it at bedtime because overnight while you're sleeping is when you're making all your steroids. When you go to bed, testosterone levels are the lowest they get all day. When you wake up in the morning, they're the highest they get all day. And so, of course, we're expected to perform our husbandly duties at bedtime when our testosterone is low. But, life's unfair.
Maybe switch it around then to the morning. It sounds like it's a good idea. Yeah, that's great.
Right.
And it sounds like
you can get enough sleep, you'll be perky in the morning when you wake up before your alarm and have some energy to do that.
There you go. That's great. Yes, great advice for all the men out there. Just back to the labs for a second. So if the testosterone is lowest at night and highest in the morning, do we want to check the testosterone for lab work in the morning? Is
Great
that the
question.
best time?
No, I don't think so.
Okay.
Well, yeah, I mean, look, if you ask the experts at the Endocrine Society, they say, and the urologists, they all say testosterone should be checked at 9 o'clock in the morning. And I've had a lot of kids, and I know you don't check the kids when they're making happy noises and everybody's getting along well. You check the little beggars when they're quiet. That's when you need to check the kids.
Okay.
Because they're up to something. So I check my testosterone levels in the early afternoon. I don't check it, at 4 o'clock before the lab closes. I'm a big believer in mid-dose. If you have a peak and a trough, I don't test it at peak. I don't test it at trough. I test it about in the middle because that's about the average a person is going to have that day. So, when I test thyroid treatment levels, I will often test the sex hormones at the same time, and I test my thyroid the same way between doses. So it's usually around noon. So that's when I test it.
Okay, around noon or 1 or something. Okay, got it. You were talking about saw palmetto before. Let's kind of go back on
just
that
mentioned
train.
it. Saw palmetto really is an herb that I give to women instead of men.
Okay.
But for men, it's good for symptoms of prostatism, lower urinary tract symptoms, but not for the reason most people think. Saw palmetto is a 5-alpha reductase inhibitor. So it blocks the conversion of testosterone to dihydrotestosterone. But that's not really why it works in the prostate. It also contains chemicals that relax smooth muscle. And the prostate symptoms are usually caused by lack of nitric oxide stimulation and problems relaxing your smooth muscle. So, the best treatments for prostatism is not dutasteride. Really, it's Cialis and saw palmetto.
Or maybe nitric oxide supplements then would be potentially helpful.
And that's on my list of things that I use is L-arginine, L-citrulline, and beetroot. Those three guys really restore nitric oxide synthesis. You can get a product called Neo 40, or you can just go to Vitamin Shop. They carry L-citrulline.
Are you into the salivary nitric oxide test strips? We sometimes
no.
see that,
but a guy came and lectured at AAEM and handed it out, and 95% of the people in the audience had a bad nitric oxide test. And this is a big group of integrated practitioners who are doing all the stuff. So I had a hard time thinking that the test was as accurate as the speaker claimed, personally.
Yeah.
Maybe he's right. I mean, maybe.
It's either it's kind of, everyone is low, or, it's showing that it's low anyway. But it's an interesting issue.
It is interesting. And so that's it for the over-the-counters that I use. And then medications, if we're getting no joy, and medications.
We need joy. Yes.
We need joy.
We need joy.
So metformin is a lot less expensive than berberine, and it works as well or better. An anastrozole, 1/4 tablet every other day or every third day, is like $10 a month, even if you don't put it on your insurance. It's a lot cheaper than Krycin. And then clomiphene is fantastic to restore the normal hypothalamic pituitary gonadal stimulation, bring the LH and FSH back up to normal, or ever so slightly high, and bring the testosterone to a really good range.
Are
I'm
you stacking
amazed.
these medicines, Alan, with your patients, or are they like one at a time and see how they do?
Um,
Like clomiphene and
define what you mean by
anastrozole.
stacking. You mean give them all at the same time?
Well, I don't mean playing Jenga, although that's another thing. But yeah, either you can give them all at the same time, all at one time, or do you stack them,
I,
in a way where you're serially adding them if they're not getting
yeah,
results?
I'd say sequentially is
Yeah,
is a better word than stack.
yeah,
But yeah, the one of the basic rules in therapeutics, I think, is try not to do two things at one time, because if
yeah,
something blows up in your face, you'd like to know which one it is.
correct.
And my
That's
patients
also
tend to be fairly sensitive. They've
okay.
been sick a long time and they're kind of puny. Um, so uh, I look at the lab and the indications. Now, in the December 2022, the most recent December issue of Townsend, I put in an article on uh, restoring testosterone secretion in patients with late onset hypogonadism. And so it talks about all the other stuff besides giving testosterone, and it will give the details and how I treat it and why I treat it and how much I use of what. So I think it's a really good article. I think you'll like it
Yes,
if you haven't seen
definitely
it.
pick that up.
And it's a free download online.
Is that when they started converting to from paper to online, or
Yeah.
is it still
No,
a paper one?
that was the next to last issue. The
Okay,
January issue
it's
is the
definitely in
last.
my email, and shout out to Jonathan Cullen and all the work that he's done and the whole editorial staff. And I know you're a big part of
Yes,
that too, with
I'm a big
as
fan
being
of theirs. I'm not
yeah.
a big part of it. I'm just really lucky that
You read a lot of
they
articles
give
for
me
them for
something to
sure, but
say.
yeah, yeah,
Yeah, I
that's
sent
good. Yeah.
my old chairman sent an article into the journal Urology once.
Oh, nice. How'd that
They
go?
weren't. I just wrote it for the boss, to show him what I was thinking, and so he thought, well, this looks like it could be published, and it was dumped on, should I say?
It
They
didn't fit inside the box.
it
Yeah,
didn't
yeah.
fit in the needs of the journal.
Okay,
Right.
okay,
So
okay, okay.
I'm really lucky that Townsend has published me. But but clomiphene is a SERM. It's an estrogen receptor blocker. And what it does, it acts in the brain for sex hormones the same way low dose naltrexone acts in the brain for cortisol. It blocks the receptor for a little while, and the brain says, oh, I have to push harder. And then it pushes out more LH and FSH. And when you've got the cytosine AD to provide all the nutritional cofactors, and you got the DHEA to provide the precursor, or even if not, then oftentimes the body will just crank it right up. Testosterone I've got a slide I could show you, but it's getting late. But testosterone is my last resort. And true to say, right now in my practice, which is shrunken as I've gotten old, I'm trying not to see new patients. I don't. And but I don't have anybody taking testosterone, either topical, injection, sublingual, anything in my practice. There's one guy who's gone out to get pellet implants from a doc because he wanted to have supraphysiological doses, which I have found in the literature is dangerous. So that's a final comment that maybe we can say before we close, is that too much is too much, and it shortens your lifespan. Too little shortens your lifespan. Too much shortens your lifespan. There's a reason the average is average, and the reason is that gives our ancestors the best survival
Got it.
chances.
That's a great closing point, Alan. It sounds like you've been able to really help your patients and get that testosterone up to, optimal without going overboard, even without
Yeah.
giving them, quote unquote hormone replacement medication,
Yeah.
testosterone, which is
I
pretty
have
amazing.
guys with total testosterone in the 600s and free testosterone well up into the 20s with immunoassay, doing nothing but clomiphene and nutrition.
Got
So
it. That's
that's
so great.
plenty.
That's so great. Thank you so much. Well, we should say one more thing about that, because if someone is, say, 20 or 30 years old and they're trying to have kids, I know there's a question about if someone has testosterone exogenously that would suppress their
Absolutely.
pituitary hormones, and then that would lead to functionally them not being fertile potentially.
That's
Is
right,
that
Andy.
accurate? Yeah.
Absolutely.
Okay.
Yeah. I mean, I always think of Sean Connery. It will shrivel your balls to the size of raisins.
Was that one of his movies, or?
No, it's just
Oh,
the accent.
just the accent. It's great. It's a great accent. You should go to Hollywood and check that out.
Hardly,
Yeah.
hardly. But it's there are a lot of articles on young men with primary hypogonadism and treating them with LH and FSH. And if you have an older guy, you can restore his fertility with clomiphene.
Right.
Easy breezy. And then like, yeah,
So
there are
so
a
so
lot
you're
of
saying,
fun stories that are kind of vulgar, and I'll skip them all.
so we don't want to shrink our balls like raisins, number one. And in terms of going to that breakfast analogy, we want to have a good amount of testosterone, but kind of like the bowls of oatmeal, three little bears in the oatmeal. We don't want to have a cold oatmeal or hot oatmeal. We want to have it
Right,
just right.
right.
It
Yeah,
sounds
there's
like.
in my women's hormone replacement lecture, I have a slide that talks about the people who argue that women should have hormone replacement are correct, because the risk of complications, the lower your estrogen level, the higher your risk of complications. But the people who say that estrogen replacement is a bad idea are also correct, because the higher your level of estrogen, the higher your risk of complications. So what I'd look to do is find the valley. Where's the lowest part where you have the least risk of any complication? And bear in mind that this is off the baseline just a little bit. So there's no place where there's no risk. And we're all going to die, you know?
Yeah. What is the
So
balance between yin and yang? It sounds like is what we're looking
here
for
we
there.
go.
Yeah.
Absolutely.
But thank you so
The
much, Alan,
Taoists
for
said it
coming
right.
on. Yes, the Dallas. Thank you so much for coming on today, Alan. This has been a really enlightening conversation about low T.
Wow.
And thank you so much for offering your wisdom to, all of us here in our community. We really appreciate you.
Well, Andy, I think you're really an awesome physician, and you've made a really good practice with smart people giving great medical care in
Team
my
is amazing,
hometown,
yes.
which I really appreciate.
Thank
Thank
you.
you
Thank
very
you.
much.
So we have one more question for you, which we kind of do as a bonus, if you don't mind. So we have a
Sure.
question on basically, we talked about cheap Scots and Chinese a little earlier. So we're going to talk about how to make integrative healthcare more accessible. What can we do to focus on the small steps that we can improve our health? So we kind of love to hear from you. We're in an inflationary period right now. There, our money probably can't even buy like a cheap plastic toy now, but things like that. But what is one thing under $20 that you feel has personally transformed your health that maybe listeners can kind of take practically? And it doesn't have to be about low T. It can just be about really anything.
Well, I don't want to dissemble. I've Hashimoto's disease and low thyroid, and when I first started taking it, Armor Thyroid was less than $20 for 100. That was really good stuff.
Yeah.
I think the best bargain that we can do right now is a good diet and lifestyle. I mean, absolutely no sugar, no starch. Really cool it with the fruit diet. And
Nice.
it's more expensive. Unfortunately, shopping the periphery of the supermarket is more expensive. You have to buy good vegetables. You have to buy some meat. That you don't have to buy a lot of meat. You should buy some. Buy eggs. Um, but God, avoid the packaged and the canned and the tinned and the stuff that is in a bag and lasts for 6 years
But
on your
yeah,
shelf.
but that more expensive and regenerative organic whole foods is really the best return on investment that we could have. So in a way, it would save money over time with people to save their healthcare bills and stuff like that.
It really does. I went on to a Candida type diet in the late 80s, and I'm 70 right now, and I don't feel it except when I had to have my hip replaced where I fell on it during ice skating repeatedly. The second time got me after
Oh,
7 years of degeneration. So 7 years and 2 falls after. But I think I'm in pretty good metabolic shape. And I see patients who are a lot younger than I am who are in tough shape. And that's, I think, the best bargain you can do is good diet and lifestyle. It's hard to walk. The first 10 steps are really hard, but it's cheap to go out and walk around your neighborhood for a mile. Walk for 30 minutes every day. It's cheap to go to bed on time. Turn off the TV, turn off the blue lights, you know, uh, leave a night light out. So if you have to get up and go to the bathroom, you don't turn on the light and ruin your melatonin. So diet and lifestyle. Yeah,
Yeah,
that's
and
the
being
answer.
aware of that. Thank you so much, Alan. Thank you so
Well,
much again. Great to
thank
see
you,
you.
Andy. God
Thank
bless
you
you,
so much.
man. Thanks for the good work you do.
Thank you too. Thank you.
Thank you so much for joining us today for this episode of the Capital Integrative Health Podcast. A quick reminder that the information we share on this podcast is meant for educational and informational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. We highly recommend that you speak to a qualified healthcare provider before making any medical or healthcare decisions. If you enjoyed this episode, please take a few moments to subscribe and leave us a review. Your reviews help us reach more people and continue to offer innovative insights and information to better optimize your health and wellness.